Hey guys, welcome back to another video, and today we're going to be going over sicknesses and issues to look out for horse edition. Before the video starts, I'm going to go ahead and give a quick disclaimer. Go ahead and pause the screen to read that out. Alright, now that you've read that, let's go ahead and get started. Colic is a painful problem in the horse's abdomen. There are several different kinds of colic and is one of the most common ailments that a horse can get. I'll give you details about two different kinds, but leave a link down below to give more information about various other ones that I did not mention. First one that I'll be mentioning is gas colic. Gas colic happens when microbes in the colon produce excess gas, which then stretch the gut wall, causing mild to moderate pain. Most gas colic clears up without much treatment, but gas colic can lead to the colon moving out of its normal place. That leads me to my second colic, colon shift colic. This is a very severe version of colic that causes the colon to twist and shift in the horse's abdomen, sometimes even hooking around other organs. This kind of colic requires immediate surgery and is very dangerous due to how much gas buildup happens when the gut twists. Symptoms of colic: frequently looking at their side, biting or kicking at their flank or belly, lying down and rolling a lot, little or no passing manure, irregular looking manure, poor eating behaviors, change in drinking behaviors, heart rate over 40 to 50 beats per minute, tacky gums, long capillary refill time, and off-colored mucous membranes. Each colic is unique, so there are many different things you can do to prevent it in your equines. Check in with your vet first and set up a healthcare plan for your horse, especially if it is prone to colic. Always make sure you have fresh water for your horse, avoid feeding your horse hay in sandy areas, turn out your horses in grassy areas for grazing, float your horse's teeth every 6 months, control parasites by deworming and vaccinations, try not to feed your horse too much grain, and finally, if changing diet or exercise schedules, make sure you monitor your horse for colic, as they can even colic due to mass amounts of stress. If your horse gets colic, the first step you must take is to call your vet. Until your vet gets there and gives you the instructions on how to proceed, there are a few things you can do to help your horse. When a horse colics, the first thing they will want to do is roll. Don't let them roll, as that can cause their gut to shift more, resulting in worse gas buildup. Instead, get your horse on a lead rope and walk them around to encourage them not to roll. Some horses may start sweating as well, so hosing them down with cool water will help them cool down and relax. Refrain from giving them more food unless instructed by a vet to do so, but keeping a bucket of fresh water nearby is definitely encouraged. Fatality rate. Colic is the leading cause of death in horses, being 31.2% of deaths in horses aged 1 to 20 years old. For horses over 20 years old, colic is the second leading cause of death. Gastric ulcers are sores that form on the stomach lining. They can affect any horse at any age and happen most commonly in horses that perform activities such as racing, endurance, and showing. Researchers have found that exercise increases gastric acid production and decreases blood flow to the GI tract. Gastric acid can cause irritation to the sores in the stomach lining. Symptoms: poor appetite, dullness, attitude changes, reluctance to train, poor body condition, poor hair coat, weight loss, low-grade colic, and girthiness. More severe cases will have your horse showing signs of abdominal pain and they might grind their teeth. Some horses, mostly foals, are found on their backs, as that position seems to give some sort of relief. In foals, stomach ulcer symptoms also include reduced nursing, colicking after nursing, diarrhea, a pot-bellied appearance, grinding of teeth, and excess salivation. Prevention and treatment. If your horse, especially your foal, exhibits these symptoms, immediately call your vet. This condition can lead to serious issues including death if not treated with medication. There is only one pharmaceutical treatment to give currently, and it is up on the screen right now. It is approved by the FDA as a drug used for equine gastric ulcers, and although it is expensive, it works well to help your horse. There may be other options price-wise to get this drug, but it is not recommended to give over-the-counter medication that is not prescribed to your horse. Some things to help prevent stomach ulcers include limiting stall confinement and stress for your horse and certain feed management practices. Contact your vet for the best course of action. Rarity. Stomach ulcers are common in horses, estimated between 50 and 90% of horses get stomach ulcers in their lifetime. Fatality rate. Very severe gastric ulceration can lead to the stomach lining rupturing, which is almost always fatal. Gastric ulcers are relatively easy to treat and prevent though, so your horse should not get to that point unless if you wait too long.
When blood flow in the hoof is affected, the inner sensitive tissues, laminae, are starved of oxygen and nutrients. Over time, this leads to inflammation and swelling, and eventually the tissue begins to die. When the laminae is damaged, the pedal bone begins to rotate, making it very painful for the horse. Laminitis is more commonly in the front feet, although there have been cases of laminitis in the back feet as well. Any horse can get laminitis at any time of the year. There are two other possible versions of laminitis that are irregular: inflammatory laminitis and hormonal laminitis. Diseases that are linked to inflammation can trigger laminitis. Some of these include colic, diarrhea, severe pneumonia, or retained placentas in mares. There are also two hormonal diseases that can cause laminitis, those being Cushing's and equine metabolic syndrome. Cushing's, often found in older horses, is a disease that affects the pituitary gland, which then causes an overproduction of hormones. Some symptoms of this include excessive hair growth, abnormal fat deposits, lethargy, and laminitis. There is no cure for Cushing's, but it can be managed with medications and supportive care. Equine metabolic syndrome is a sickness that causes horses to have a resistance to insulin. They have difficulty losing weight and are more prone to getting laminitis. Medication and increased exercise can help with EMS. Symptoms. There are 3 stages of laminitis with varying symptoms. The first stage is subclinical laminitis. In this stage, the hoof is starting to change. It can be hard to detect this stage as it may not cause your horse much physical pain. The second stage is acute laminitis. And these following symptoms come on suddenly and very severely: an inability or reluctance to walk, reluctance to get up after laying down, a hoof that is hot to the touch for long periods of time, visible lameness, leaning back onto the hind feet, also known as lamnic stance, an increased heart rate, and an increased digital pulse on the foot. The final stage is chronic laminitis, which is usually the aftermath or a sign of relapse from acute laminitis. Symptoms of chronic laminitis include a crusty neck, buildup of fat on the neck, lameness, abnormal hoof growth, growth rings around the hoof wall, and a bulge in the sole of the hoof where the pedal bone has rotated. Prevention and treatment. If you suspect that your horse has laminitis, immediately call the vet. Your horse will be in extreme amounts of pain, so try to limit their movement and keep them in a nicely bedded stall. Thick shavings so there is cushioning under their hooves is highly recommended. There are several things your vet might recommend: painkillers, extended stall rest on a deep bed of shavings, therapeutic trimming and chewing, and dietary changes. With an early diagnosis and proper care, your horse should make a good and quick recovery. To prevent laminitis, make sure you clean out your horse's hooves regularly, as well as have a farrier come out to trim your horse's hooves. Maintaining a good low-calorie diet, as well as a healthy weight, will also contribute to preventing laminitis. Rarity. Relatively common. Currently, laminitis is ranging from 1.5% to 34% of horses. Fatality rate. Laminitis can be fatal to horses, with more than 7% of equine deaths related to the disease. In another study, 4.7% of cases resulted in death or euthanasia. Arthritis. Arthritis is a condition where joints swell and become inflamed, which occurs in horses of all ages and disciplines. Over time, if this condition becomes chronic, it can lead to damage and deterioration of the surrounding soft tissues, cartilage, and bone. This is a non-reversible disease that is encountered most often nowadays as horses' lifespans are lengthening. While there is no cure, there are many ways that you can keep your horse comfortable. Symptoms: stiffness, pain or lameness, limping, stumbling favoring certain limbs, swelling or heat around joints, popping or cracking noises during movement. Prevention and treatment. Ways to manage arthritis in horses include daily exercise, daily anti-inflammatories, intra-articular steroids, systemic joint injectable support such as Adequan, oral joint supplements such as Cosequin or Lubricin, and alternative modalities such as acupuncture or chiropractic work. In some more severe cases, surgical or chemical fusions of joints may help as well. Contacting your vet when you suspect your horse has any type of arthritis is the best way to go. Rarity. Arthritis is a very common condition in horses, affecting more than half of horses over the age of 15. It's a leading cause of lameness in horses, accounting for up to 60% of all cases. Fatality rate. The survival rate for regular arthritis is 90%, as treatment works quite well. However, the mortality rate for septic arthritis In horses is high, ranging from 28 to 58% even if it's treated. Foals with septic arthritis have an even higher fatality rate at around 42 to 84%. Equine asthma. Equine asthma, an allergen-based inflammatory disease of the airways, is common in adult horses of all different ages. This condition also may be referred to by other names such as heaves, broken wind, and chronic obstructive pulmonary disease, COPD. Most recently, equine asthma has been adopted as a terminology to describe the three related conditions of the inflammatory airway disease, IAD, recurrent airway obstruction, RAO, and summer pasture recurrent airway obstruction, SPRAO. There are two different kinds of equine asthma, severe equine asthma, SEA, and mild-moderate equine asthma, MEA. If you suspect your horse has asthma, contacting your vet immediately is recommended. Symptoms: coughing, mainly after exercise and feeding, noisy breathing, wheezing, nasal flaring, fast respiratory rate, nasal discharge, using abdominal muscles to assist breathing, flanks moving in and out with each breath, reduced tolerance for exercise, and crackles and wheezes that can be heard through a stethoscope. Prevention and treatment. Similar to humans, there is no actual cure for asthma that gets rid of it forever. However, there are plenty of ways to manage the symptoms. Talking to your vet would be the first step, as treatment varies from horse to horse. There are a few things for you to do that your vet may or may not recommend for your horse. First, and most common thing, would be medication. Anti-inflammatories and bronchodilators are the most common, as they both can reduce inflammation and open up the airways. Next would be to simply reduce the environmental triggers. You can turn out your horses in grassy areas more and switch over to thicker, dust-free bedding to reduce your horse's exposure to dust. Improving ventilation by keeping horses in clean, open stalls can also help, along with not storing hay above or around stalls. That will limit dust and mold. Rarity. Severe asthma, SEA, affects around 14 to 17% of horses in colder climates, more commonly in senior and adult horses. Mild-moderate asthma, MED, affects 68 to 77% of pleasure riding horses and 80% of race horses. Fatality rate. Luckily, this condition is rarely fatal in horses. However, there are issues that can happen due to ongoing high blood pressure in the lungs and heart. The issue is called cor pulmonale, also known as right side heart failure, and that is unfortunately, in most cases, fatal. In some instances, owners cannot keep up with the cost of medications for asthmatic horses and may choose to euthanize it. In most instances, that is not needed, and contacting your vet is crucial to see what you can do for your horse. Strangles is a bacterial infection in horses similar to strep throat in humans. Strangles can stay active in water buckets in moist areas for 4 to 6 weeks, and the bacteria can survive for about 1 to 3 days in drier areas like on fencing or in dirt. The bacteria is normally transmitted through nose-to-nose contact with an infected horse, but horses can catch the illness by being around something that is contaminated with the bacteria, like a water bucket. Symptoms: fever, nasal discharge, swollen lymph nodes, abscesses, loss of appetite, lethargy, and noisy breathing. Prevention and treatment. For prevention, the best thing to do is to avoid sharing food buckets, water troughs, and tack with other horses. If you purchase a new horse, make sure you quarantine them for a short amount of time so that if the horse is infected with strangles, other horses don't catch the illness. If your horse gets strangles or exhibiting symptoms of strangles, immediately quarantine them and call your vet. Strangles is highly contagious, so when you handle the infected horse, it is recommended to change clothing and shoes before handling other healthy horses. The good thing about strangles is that it normally goes away on its own and does not need much treatment. It is not recommended to give your horse antibiotics for strangles unless if they are experiencing complications, and this is because a recent study has shown that giving antibiotics reduces the chance of your horse developing a strong immunity from the virus. About 75% of horses that get infected have protective immunity from the strangles for at least a year afterward. Rarity. Very common. Fatality rate. It has less than 10% mortality rate. The mass majority of horses recover from the sickness. Several articles state that around 1 to 2% of affected horses die from strangles. Hoof abscesses are pockets of pus and inflammatory products that form when bacteria enters the hoof. Causes of hoof abscesses include
nails, screws, or glass damaging the hoof, horseshoe nails inside the white lining of the hoof, where the hoof wall meets the sole, dirty stalls, poor hoof care, and poor hoof quality caused by the environment or genetics. When referring to environment-related hoof abscesses, it's usually caused by wet weather or changes in weather that crack and dry up the hooves. Symptoms: lameness, limping, stumbling, favoring certain limbs, increased warmth in the area, swelling and inflammation, discharge, and an increased digital pulse. Prevention and treatment. To prevent an abscess, keep your horse's environment clean and dry. Take manure and urine piles out of your horse's stalls and keep the paddock sanitary. Apply hoof hardeners or moisturizers depending on the weather changes in your area. Moisturize when dry and hot. Hardener when heavy rainfall occurs. Routinely have a farrier trim your horse's hooves and check paddocks for glass, nails, and metal pieces so your horse does not get more injuries. If you suspect or know that your horse has an abscess, call your vet to see what the best treatment for your equine would be. The most common solution that your vet will do is to drain the abscess and bandage up the hoof with an antiseptic-soaked bandages to prevent any infection from festering. Do not attempt to drain the abscess on your own, as doing it without proper knowledge can cause the abscess to worsen. Rarity, very common. Fatality rate. Hoof abscesses are rarely life-threatening, and most horses recover from them without any complications. Rain rot, also called rain scald, is an infection that lives on the horse's skin. The bacteria is mostly dormant, but when there are wet conditions, it can cause an infection resulting in lesions. Rain rot can be found on multiple parts of your horse's body, including the face, flank, back, and legs, so it is important that you do full-body examinations of your equine regularly. All horses can be affected by this condition, but horses with compromised or bad immune systems, younger or older horses, are at higher risk for getting rain rot. This is most commonly seen where there is high humidity, long periods of rainfall, or increases of biting insects. Symptoms: bumpy skin, hair loss and clumps, painful scabs, large lesions, and mats of hair. In severe cases, there can be yellow-green pus, poor appetite, fever, and weight loss. Prevention and treatment. The main prevention is to practice good grooming and bathing hygiene tactics so that rain rot does not have the opportunity to begin to fester. If you know that there is going to be heavy rainfall, having an overhang or covered area for your horse is highly recommended. Keeping them out of muddy areas is also a good practice, as too much mud on your horse's skin can also cause rain rot. Rarity. Very common. Fatality rate. In very, very, very rare cases, horses with severe rain rot infections can be euthanized if their quality of life is poor. However, in most cases, it is 100% curable and the horse will be just fine. Above in this photo is coat defense, and in this photo is Equiderma skin lotion. These two are really good products for your horses when they have rain rot. My horses get rain rot very frequently since I live in Florida, so these two work very well, so I highly recommend them. Thrush is a bacterial or fungal infection that develops in the frog of the horse's hoof. Hooves with frogs that have deep grooves on the side are prone to becoming infected with bacteria and pathogens that cause thrush. Wet and dirty environments contribute to the development of thrush, as that is where the bacteria thrives. Thrush can get worse over time and cause permanent lameness if it results in a bad damage to the hoof. Treating thrush quickly is the best way to stop the spread of the infection. Symptoms: there should be a lot of hoof tenderness and a foul-smelling black discharge from the hoof. Other than that, your horse might show other symptoms of discomfort like limping, favoring certain limbs, bobbing its head up and down, or laying down and not moving due to not wanting to be in pain. Prevention and treatment. Treatment of thrush involves removing the dying or infected tissues from the hoof, disinfecting it, and keeping it clean while it heals. Make sure that you do not do this yourself. Have your farrier come out and take care of your horse if you suspect they have thrush. To prevent thrush, clean out your horse's hooves, have regular farrier visits, and keep the living space clean. Personal recommendation for prevention and treatment is Duvet's Thrush Rid or Mustad's Thrush Buster. Tetanus, also known as lockjaw, is a bacterial disease that is frequently fatal in horses and humans without quick medical treatment. Horses are generally more sensitive to tetanus than humans and other animals, as tetanus spores enter the horse's body through deep or shallow wounds. Horses with ulcers can be infected after ingesting infected feces, and it has been estimated that around 10 to 20% of horses have C. tetani in their feces. Symptoms: general stiffness, muscle spasms, severe or mild, difficulty swallowing, chewing, or drinking, prolapse of the third eyelid, sensitivity to touch, sweating and fever, convulsions, sawhorse stance, respiratory arrest, and death. Prevention and treatment. The best way to prevent tetanus is to just stay up to date with your horse's vaccines. There are 4 major vaccines that I recommend to give to your horse: tetanus, rabies, West Nile virus, I'll be mentioning this one later, and Eastern equine encephalitis, similar to West Nile virus. If you believe your horse has tetanus, contact your vet immediately. Rarity. Common, but is preventable and manageable by vaccine. Fatality rate. Fatality rate can vary depending on the horse and how bad the condition is, but usually the rate is relatively high at 50 to 80%. Equine influenza, also known as horse flu, is a highly contagious disease caused by the influenza virus that spreads in horses and closely related animals like donkeys and zebras. The viruses cause flu-like symptoms similar to the flu in humans. However, horse flu does not have a huge risk factor on people. Although it is rare, a few people in contact with infected horses have developed antibodies to equine influenza viruses. Antibodies are a sign of having been infected. Symptoms: fever, dry cough, wheezing when breathing in more severe cases, loss of appetite, fatigue, and runny nose. Prevention and treatment. Vaccines to protect horses against horse flu has been available since the 1970s, and they help protect against the most commonly spreading equine influenza viruses. When your horse starts to show symptoms of equine influenza, call your vet so your horse can get the best treatment possible. If you have other equines, try to quarantine the infected horse away from the others so that the disease does not spread. Cleaning and disinfecting areas that the infected horse was in is also recommended for your other equine's health. Rarity. Very common. Fatality rate. Less than 1%. Horses generally get over the sickness quickly and are just fine. In 1999, the first equine case of WNV was reported in the United States, with thousands of cases reported in the following years. Mosquitoes contract the virus from infected birds and then give it to humans, horses, and other animals. Mosquitoes only get the virus from remic animals, which means the animal has a high enough viral load in its blood that the mosquito ingests the virus and becomes a carrier. All horses can contract this virus, but unvaccinated young and elderly horses face a heightened risk of severe illness. Symptoms: muzzle twitching, abnormal mental activity, head and or lip drooping, facial paralysis, difficulty swallowing, incoordination, hind limb weakness, inability to stand, sensitivity to touch and or sound, muscle weakness, trembling or muscle twitching, and skin twitching. Other abnormal activities include head pressing, circling, and teeth grinding. Sometimes the sickness even causes visual impairment, ranging from aimless wandering to blindness. Prevention and treatment. To prevent this disease, as mentioned in the tetanus section, making sure you have your horse up to date with vaccines is crucial. Much like other viral diseases, treatment of West Nile virus is focused on providing the horse with supportive care, as antiviral medications often do not work. When you think your horse could possibly have WNV, contacting your vet immediately is the best thing to do. Here are some things your vet might do for your horse. Banamine has been reported to reduce muscle tremors and twitches, and with that, if needed, sedatives can be given to your horse to reduce anxiety. If the horse struggles to eat or drink, intravenous fluids may be needed to prevent dehydration. Horses might need supportive care for up to 6 months before they return to normal functioning, and in some cases your horse may not return to functioning normally. In those kinds of cases, euthanasia would be the best option. However, refrain from telling your vet what to do. Talking to your vet to see what you can do for your horse specifically is the correct thing to do. Rarity. It is quite rare due to the fact that there are vaccines given to prevent it. Normally, the rate that horses can get it is around 10%. Fatality rate. 30% to 40% fatality rate in horses who catch this illness. Equine infectious anemia, EIA, is a viral disease only found in equids: horses, mules, donkeys, ponies, and zebras. This disease can be difficult to pinpoint and is often confused with other ailments. It is found worldwide, but is not a threat to human health. Symptoms: fever, decreased appetite, severe anemia, sudden death, jaundice, rapid breathing and heart rate, swollen limbs, bleeding from the nose, and blood-stained feces. Prevention and treatment. Biting blood-feeding flies spread this disease from one animal to another. It is most commonly spread by horse and deer flies. It can also be spread by used needles or not properly cleaning veterinary instruments, tattoo equipment, dental instruments, syringes, blood transfusions, etc. There is no cure for this sickness. When an equine catches it, they have to go to immediate quarantine and most likely get euthanized. To prevent this disease, there's a couple things you can do. Control the amount of biting flies on your property with repellents. Never reuse any needles, IVs, or syringes. Only use licensed and approved blood products from donors that test negative for any bone and blood illnesses. And make sure any blood transfusions are performed by a licensed veterinarian. And also, test your equines annually for EIA. If you suspect that your equine has EIA, immediately remove them at least 200 yards away from any other equine on your property and call your vet. Rarity. In the United States, the rarity of the disease has increased in the past few years due to how careful people have been. It now affects an estimated 0.004% of the population, where in 1970 it had affected nearly 4% of the population. Fatality rate. Most deaths occur in foals, which have mortality rates reaching up to 80%. Most sources state that there is a mortality rate between 30% and 70% in the average adult horse. Most horses remain asymptomatic carriers and do not die from the disease. And that wraps everything up, guys. Thank you so much for watching. I know this was a really, really long video. I hope it was helpful for anybody who is wanting to learn more about horse sicknesses and illnesses, or is planning on getting a horse and just wants to know more about horses. So hope you guys like this video. I'll see you guys in the next one. Bye.